Being a new parent is challenging in the best of circumstances, but it's even harder for expecting and new moms struggling with social and behavioral health needs. And living in a rural community means that the resources available to support new parents may be limited. The first 1,000 days, from pregnancy to age 2, offers a crucial window of opportunity to create brighter, healthier futures. Welcome to Rural, a year-long series devoted to rural hospitals and health systems in America. I'm Tom Hetterly with AHA Communications. St. James Healthcare in Butte, Montana, now part of Intermountain Health, is designing care around new moms who need the extra support, not just during pregnancy, but during the first 2 years of the baby's life. At this year's AHA Rural Healthcare Leadership Conference, Julia Resnick, Director of Strategic Initiatives at the AHA, spoke with April Ennis-Kipel, Community Health Director, Montana-Wyoming Market at Intermountain Health, and Jocelyn Hubbard, Social Worker at Intermountain Health St. James Hospital, about how their first 1,000 Days program provides wraparound services for at-risk new moms. They were joined by Lacey Starcevich, a former program participant who shares her powerful journey to build a healthy life for herself and her family.
April and Jocelyn and Lacey, thank you so much for recording this podcast with us. We're here at the AHA Rural Healthcare Leadership Conference. I'm really pleased to have all of you. So to kick things off, let's get a little background on your healthcare system. So can you tell us about Intermountain Health, St. James Hospital, and the community that you serve? April, do you want to kick things off?
Sure. So we are part of a large system, Intermountain Health, that includes hospitals in Montana, Colorado, Utah, clinics in Nevada as well. And St. James is located in southwest Montana. It's a community of about 35,000 residents. Is a level 3 emergency department and really provides services for all the surrounding counties, which are primarily rural counties.
Anything else you both want to add about the hospital or your community?
Butte is a really proud community. It has a long history of mining, and people are proud to be from Butte. They help each other out. They come together to support one another, and it's just a beautiful place to live.
And Butte was known as the richest hill on earth at one point, and at one time was the largest city between Chicago and San Francisco in its heyday. So rich history in the community.
That is quite a history, and I love that piece about community because I think that's really what we're here to talk about. And our focus today is really on maternal health. So Jocelyn, can you talk at all about the maternal population that you're serving and where your patients come from?
Yeah, so most of our patients live in Butte or Silver Bow County. We do serve the women from the surrounding counties as well. Our payer mix at our hospital is, around 85% Medicare and Medicaid. And we have women primarily of Caucasian descent. And we serve ages, teenage to later advanced maternal age, they call it. So, but just a really great mix of that.
And even though most of your patient population does identify as white, are there any disparities that you've identified between different subsections?
So a lot of the disparities we see in our community health needs assessment are actually related to socioeconomic status. Individuals living in poverty across all health outcomes have poorer outcomes. So anyone 200% or less of the federal poverty level just scores worse on a number of health outcomes.
April, do you know what population of our patients fall within that 200% below poverty level?
The residents, I would say about 20% of overall residents, so 1 in 5, are below the poverty level.
Got it. And when you're thinking about these new parents in your community, are there any particular challenges that you've been seeing them experience? I know you touched on their socioeconomic status and needs, but in terms of behavioral health and how those challenges are impacting them?
So we have limited resources for our behavioral health and substance use. So those definitely impact our patients' access to care, as well as when we're talking our socioeconomic struggles, it's even transportation to those appointments. It's housing. Working with women and families, it's hard to talk about getting to appointments when they're not sure where they're going to live, or stay that night, or how they're going to get to that appointment. We have to take in all of that into consideration when we're dealing with people with substance and mental health needs.
Absolutely. So we're really here to talk about the Meadowlark Initiative. So can you talk to our listeners about what that is?
I can maybe start and then you can fill in as needed. So the Meadowlark Initiative is funded through the Montana Healthcare Foundation, and it's really focused on providing intensive case management to the most at-risk patients, prenatal, and then following through till the second year of life. So really helping to guide and support both prenatally and then also postnatally. What else would you add, Jocelyn?
Yeah, so the initiative initially was funded by the Montana Healthcare Foundation, but St. James has continued that, recognizing the need and the importance of this work. And so our program was the first 1,000 days, which is from conception to age 2, recognizing that that is the most critical and crucial time in human development. And when the brain develops, it's just really using that care coordination piece to kind of bridge the gaps between those services, whether it's housing, food issues, transportation, mental health, substance use, and the clinic or the hospital, and how to connect patients when they come in for prenatal care with those outside resources, and then to continue to be a resource and a support for them as they, not only through their pregnancy, but as they embark on parenthood.
That's amazing that you have such a long perspective on it and not just, a specific part of pregnancy or postpartum. So who are you partnering with or coordinating with to bring this all to life?
In terms of community resources?
Yeah.
Perfect. Yeah. So we have lots of, we partner with all of our resources in the community, whether that's private therapists. We partner with our Southwest Montana Community Health Center to provide mental health services as well as primary care following delivery, our mental health centers and parenting agencies in the community as well.
So talk me through it. Like, someone finds out they're pregnant. How do they get enrolled in the program? Like, what happens next? What does that look like?
The hope is that they would seek prenatal care and come to an appointment. And at that appointment, they would be screened for social determinants of health. So we would be screening for transportation issues, food insecurities, housing, as well as mental health and substance use. We would also be screening the partner or whoever is supportive of that woman in pregnancy so that we can really help the whole unit. And then they would meet with a care coordinator, and that care coordinator then would connect with resources and help identify needs, provide education, and then support throughout the pregnancy.
It's wonderful. And are there any stories you can share that can really bring this to life?
Well, I'm fortunate to have Lacey here today. Lacey was one of our moms in our program, and I think that she can speak to her story better than I could ever.
Great. Lacey, over to you.
I'm Lacey. On the 22nd of February, I'll recently celebrate 5 years clean. I originally attended my first prenatal appointment actively using drugs. I was screened and obviously made the requirements for the program. At the time, I was homeless and still using. I left that first prenatal appointment, not sure if I was going to get clean or not even sure if I wanted to keep Raiden. That's my son's name. He'll be 5 in August, actually. So with the help of Jocelyn and the Meadowlark Initiative, I was able to connect with these resources and get help. And today I'm present for my children.
That's amazing. I'm just so glad you're here to share your story and that you've been involved in the program since. Is that?
Yes. So anything I can do to help. There's just so many mothers out there who are in the same position I am, and it's an unfortunate situation. But with things like this, we can try to lower that number.
And I'm sure having contact with you helps them feel less alone and that, there is a light at the end of the tunnel.
Yeah, there's nothing more therapeutic than another addict helping another addict.
Wonderful. And I know that, we have a great personal story of the impact of this work, but have you been measuring what the impact is on the women that are in the program? Yes?
Yes, we have.
Is there anything you can share?
If I look at my notes, yes. I don't know off the top of my head.
We have found that women who participate in this program are more likely to have consistent prenatal care. They're more likely to take their child home at delivery, and that means from a lower involvement of child protective services removals. Women have better health outcomes too, higher birth weights, lower complications, less hospital day stays that are involved in the care as well. And a lot of that's probably attributed to the more consistent prenatal care, as well as changing a lot of their lifestyle and ensuring that they have the food and resources that they need, as well as, hopefully not using substances.
So to wrap us up, I'd love your words of advice for other rural hospitals that are really thinking about what they can do to improve their maternal and child health outcomes. What have you learned along the way that you can share with them? And Lacey, you'll have a slightly different version of that question.
When we're dealing with rural, it's hard to find people to fill spots, right? And I think the most important thing is that we realize that just has to be someone who cares and who understands the community and the resources out there and who can show understanding and love and kindness to patients. There's not a magic wand that this is hard work, but it's done in partnerships and relationships that are built not only with the patient, but with the community. And, just really taking time, stepping back, understanding what the needs of your community are, and, just addressing it one day at a time.
Well said.
Very well said. April?
I don't know if I could really add anything more to that. I think it just, in looking at having a connector and a go-to person, I think is probably the most important thing, so that there's a single point of contact that can help move forward any of the needs and make connections. And I'm not sure that always would need to be a particular type of training to do that work. So I think in a rural community, you could customize it to really fit what you have available. But the key piece would be just to have that single person who can really help be the connector.
That human connection piece really just came out strongly in both of your answers. And Lacey, from being on the participant side of this and, having been one of the moms in the program, what do you wish that hospitals knew about working with new moms who might need additional social or emotional support?
We just need, a setting that's not judgmental. We do not have a village, and programs like this help us create that village, and that sets us up for success. They help me create my family. They help not only me get clean and deliver a healthy baby, but my husband followed in suit because they provided us the resource to be able to do that.
That's wonderful.
I just wanted to call out Lacey. Not only does she have Raiden, but she now has a 2-year-old Parker. She's married, has bought her own home, and is a role model for other women in our community, and just so proud of where she is.
I'm so glad we can lift up your story and share it with the world.
Thank you.
So Lacey, Jocelyn, April, thank you so much for joining this podcast. I look forward to seeing your presentation later today, and just congratulations on the fantastic work you're doing.
Thank you.
Thank you.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.